Hi everyone, Dr. Steph here, back to talk to you about what we find in our practice are the top 15 causes of type 2 diabetes, and in some cases type 1 diabetes. And the importance of understanding all these different elements and potential causes is if you're working to reverse your diabetes, it's important to know that it's more than just are you eating too much sugar, and then how do you find out if these things are issues for you and what can you do to get them tested. So we've gone through a few different topics in previous videos: liver dysfunction, food sensitivities, gut health, and toxins was my last video, talking about environmental toxins literally blocking insulin receptors, so causing type 2 diabetes and insulin resistance, but also inhibiting your pancreas from secreting insulin. So it's a twofold scenario. Today I want to talk to you about sex hormones, reproductive hormones like testosterone, estrogen, and progesterone, and how those actually impact your type 2 diabetes and can start to, imbalances in these hormones can actually contribute to insulin resistance. And so very, very briefly, because hormones are an entirely complex subject, but just so you can appreciate the connection between testosterone and estrogen and insulin resistance or type 2 diabetes, let's just take an example of a type 2 diabetic male. So insulin resistance in the male actually causes conversion of some testosterone into estrogen at the tissues. This conversion and hyperconversion into estrogen and relative increased amount of estrogen actually worsens and contributes to insulin resistance. And so that can cause sugars to go higher, which can then cause more hormone conversion, which then causes more insulin resistance, which then causes more hormone conversion. And we have this vicious cycle that actually starts in the man's body because of the insulin resistance to start off with, causing the hormone imbalance, and that hormone imbalance then starts to contribute. So one of the things that we do in our office is we actually assess at tissue levels through saliva testing versus just blood work where all of your sex hormone levels are. Okay, it's not necessarily even absolute numbers, it's relative numbers. In the female body, it's the opposite, and this is why for a lot of our female patients, they're converting, because of the insulin resistance, they're converting estrogen into testosterone, which is also contributing to more insulin resistance, which is causing more conversion. And a complaint for some of our female patients that have been diabetic for some time is that they're actually shaving hair off their chin. So we see the masculinization of the female body, the feminization of the male body, and these are all contributing factors. These imbalances start to become their own self-fulfilling contributing factors to type 2 diabetes. And so those have to be addressed. If you are a guy and you have low libido, it's not just enough to be thrown onto testosterone, especially if you have diabetes, because if you're not addressing the hormone imbalances and the diabetes, you could actually be contributing to the worsening of the diabetes by just taking testosterone, especially if you're going to convert it into more estrogen, and that is something that we find. So I hope that gives you guys at least an appreciation for the fact that diabetes may not just be a simple fact of you're eating too much sugar and that's causing sugars to go high. There may be some other underlying issues that are contributing to the worsening of the disease that need to be looked at and addressed. This is one of the things we test for with saliva testing. You want to find a good functional medicine doctor to be able to address these things. And oftentimes we're able to get these hormones balanced without putting people on hormones. So I hope that was helpful. Stay tuned for more videos where we talk about the other 15 different potential causes that we find in our practice for type 2 diabetes.